I work in a hospital and I often see visitors coming in to visit people, and that's how outbreaks start.
COVID cases in Winnipeg are rising as flu season gets underway and more people gather together to celebrate the holidays. All 4 Manitoba sewage sites that participate in wastewater testing are showing increases in the concentration of COVID-19 in samples. 3 of those sites are in Winnipeg, with samples from the city's west end showing high levels of COVID-19. Data from the province is also showing both increasing case numbers and increasing test positivity rates.
The courtesy of wearing a mask if you're feeling a little sick, even if it's not COVID, really reduces the risk of transmitting some of these other viruses or even COVID-19.
The uptick in COVID-19 cases comes amidst flu season. While provincial data is showing cases for the flu are low right now, Dr. Lagasse Ween says cases of the flu are rising.
Flu tends to come on very, very fast and hit very, very hard quite all of a sudden. So when they overlap, when COVID-19 and flu, and certainly if RSV comes along in a little bit and that overlaps as well, it causes a lot of stress to the hospital system.
For pharmacists across Winnipeg, vaccine uptake for both the COVID-19 and flu vaccines are mixed.
We try all the time to encourage everybody to get the flu shot and the COVID vaccine.
Imad Ibrahim is the pharmacist manager at Crossroads Pharmacy. He says while he encourages people to get vaccinated, he hasn't seen that many people receive one.
We don't have too much people asking for COVID vaccine nowadays, but for flu shot, not pretty much, just few people.
For other pharmacies, though, it's the opposite case.
Haven't really noticed much of a drop-off here, at least. We actually haven't been able to keep up with the demand, especially with the COVID shots.
We're not seeing the uptake I would have liked to see on vaccination, and it's really important to remind people that the ideal time to get vaccinated for these types of infections, whether it's COVID or influenza, is before we get exposed.
In a statement to City News, the province says increases in COVID-19 cases are expected as more people gather indoors.
The ideal time would have been, 2 or 3 weeks ago to get vaccinated. No time like now if you haven't been vaccinated, because we've got the whole rest of the wave to contend with, and influenza is just starting.
In Winnipeg, Djan, City News.